This is IBG News Golden Hour podcast and news read by Arthur. WHO report signals increasing resistance to antibiotics in bacterial infections in humans and need for better data. Friday the 9th of December 2022, Geneva. A new World Health Organization, WHO, report reveals high levels of resistance in bacteria, causing life-threatening bloodstream infections, as well as increasing resistance to treatment in several bacteria causing common infections in the community based on data reported by 87 countries in 2020. For the first time, the Global Antimicrobial Resistance and Use Surveillance System, GLASS, report provides analyses for antimicrobial resistance, AMR, rates in the context of national testing coverage, AMR trends, since 2017, and data on antimicrobial consumption in humans in 27 countries. Within 6 years, GLASS achieved participation from 127 countries with 72% of the world's population. The report includes an innovative interactive digital format to facilitate data extraction and graphics. The report shows high levels, above 50%, of resistance were reported in bacteria frequently causing bloodstream infections in hospitals, such as Klebsiella pneumoniae and Acinetobacter spp. These life-threatening infections require treatment with last-resort antibiotics, such as carbapenems. However, 8% of bloodstream infections caused by Klebsiella pneumoniae were reported as resistant to carbapenems, increasing the risk of death due to unmanageable infections. Common bacterial infections are becoming increasingly resistant to treatments. Over 60% of Neisseria gonorrhea isolates, a common sexually transmitted disease, have shown resistance to one of the most used oral antibacterials, ciprofloxacin. Over 20% of E. coli isolates, the most common pathogen in urinary tract infections, were resistant to both first-line drugs, ampicillin and cotrimoxazole, and second-line treatments, fluoroquinolones. Antimicrobial resistance undermines modern medicine and puts millions of lives at risk, said Dr. Tedros Adhanom Ghebreyesus, WHO Director General. To truly understand the extent of the global threat and mount an effective public health response to AMR, we must scale up microbiology testing and provide quality-assured data across all countries, not just wealthier ones. Although most resistance trends have remained stable over the past 4 years, bloodstream infections due to resistant Escherichia coli and Salmonella spp. and resistant gonorrhea infections increased by at least 15% compared to rates in 2017. More research is needed to identify the reasons behind the observed AMR increase and to what extent it is related to raised hospitalizations and increased antibiotic treatments during the COVID-19 pandemic. The pandemic also meant that several countries were unable to report data for 2020. New analysis that countries with a lower testing coverage, mostly low and middle income countries, LMICs, are more likely to report significantly higher AMR rates for most bug-drug combinations. This may be, partly, due to the fact that in many LMICs, a limited number of referral hospitals report to GLASS. These hospitals often care for the sickest patients who may have received previous antibiotic treatment. For example, the global median AMR levels were 42% E. coli, and 35% methicillin-resistant Staphylococcus aureus, MRSA, the two AMR Sustainable Development Goal indicators. But when only countries with high testing coverage were considered, these levels were markedly lower at 11% and 6.8%, respectively. As for antimicrobial consumption in humans, 65% of 27 reporting countries met WHO's target of ensuring that at least 60% of antimicrobials consumed are from the access group of antibiotics, i.e., antibiotics which, according to the WHO AWARE classification, are effective in a wide range of common infections and have a relatively low risk of creating resistance. AMR rates remain difficult to interpret due to insufficient testing coverage and weak laboratory capacity, particularly in low and middle income countries. To overcome this critical gap, WHO will follow a two-pronged approach aiming at short-term evidence generation through surveys and long-term capacity building for routine surveillance. This will entail the introduction of representative national AMR prevalence surveys to generate AMR baseline and trend data for policy development and monitoring of interventions, and an increase of quality-assured laboratories reporting representative AMR data at all levels of the health system. Responding to trends of antimicrobial resistance requires high-level commitment from countries to boost surveillance capacity and provide quality-assured data as well as action by all people and communities. By strengthening the collection of standardized quality AMR and AMC data, the next phase of GLASS will underpin effective data-driven action to stop the emergence and spread of AMR and protect the use of antimicrobial medicines for future generations.
You are listening IBG News Golden, our podcast news read by Mirai. The Workforce Institute at UKG survey, more than half of workers in India wouldn't want their children to have their job. The survey report titled "We Can Fix Work" entails a 10-country survey of employees, C-level leaders, and HR professionals, which was done by the Workforce Institute at UKG. The report launched on 9th December 2022 at the UKG Live event happening in Sahara Star, Mumbai. This survey found that 52% of people would tell their children to pursue jobs in which they find meaning instead of being completely driven by the pay scale. While money will continue to remain a driving factor when it comes to job choices, the coming generations definitely won't regard it as the only factor. Mumbai, India, 9th December 2022. Standing at the threshold of the future of work, the Workforce Institute at UKG, which provides research and education on critical workplace issues facing organizations around the world, surveyed employees and leaders across 10 countries to get a pulse of how they really feel about their jobs. According to the results, India ranked the highest with 66% of employees stating that they wouldn't recommend their profession to their children or any young person that they care about, while 67% wouldn't recommend their employers. The full report, "We Can Fix Work," provides insight into what parents, family members, and mentors are telling children about what they should value in their jobs, and employers, urging future generations to let purpose, not money, guide career choices. It found that on a global scale, nearly half, 46%, of employees would not recommend their company nor their profession to their children or a young person they care about, and a startling 38% wouldn't wish my job on my worst enemy. Employees and leaders alike, as has been found in this report, prioritize finding meaning in their work more than making money. We have to realize that with these shifting times, we are navigating towards a generation of workers who don't necessarily rely on their job for survival. Instead, their work is more personal to them in terms of adding value to their lives and fueling their existing passions, said Neil J. Salomon, Vice President, Asia Pacific and Latin America at UKG. For a workforce such as this, we need to develop a workplace culture that nourishes and nurtures the overall development of its employees, takes care of their physical as well as mental well-being, appreciates their efforts, and maintains a mutual sense of respect with individuals at different levels of the organization irrespective of hierarchies. This, right here, is the beginning of the future of work, and employee centricity is at the heart of it. Workforce burnout. 45% of employees worldwide don't want to work anymore, period. There has been a recent rise in the anti-work mindset globally, owing to the pandemic, as 77% of employees around the world want to spend less time working and more time doing things that matter to them. Amongst the C-suite leaders, it is the younger leaders that are ready to go out of work completely, especially those belonging to the Gen Z, 58%, who say they don't want to work anymore. When compared to the C-suite leaders who are soon to be retiring from their jobs, 36% of the millennial leaders and 33% of the Gen X leaders are ready to not work anymore. Therefore, a disinclination towards work is a phenomenon that is being observed across the ranks of employees and leaders alike. Too much overtime affects the employee-employer relationship. If employees tend to work overtime more than twice per week, it strains their relationship with the employer, and they're even less likely to recommend their jobs or their companies to the next generation. This is evidenced by the more than half, 58%, of employees globally who work overtime 3 to 4 times per week and wouldn't recommend their profession to kids. 60% wouldn't recommend the organization. The report distinctly shows that more money does not equate to job satisfaction for individuals, as most people have a transactional relationship with work, and only 23% of employees genuinely enjoy their work and are passionate about it. In fact, 64% of them would switch jobs right now if they could. With purpose and trust, 88% of employees look forward to work. Now more than ever, companies must prioritize the well-being of their employees, not just for better outcomes in the present, but for their long-term sustainability in the future. Employees in India top the global charts with a staggering 89% saying that they are committed in their pursuit of a greater purpose at work, most of any country survey. What does great look like? Great Place to Work research finds people at the best workplaces around the world are living in a vastly different and more fulfilling reality than the typical employee, starting with the sense of purpose they find in their work. For those at the best workplaces, 90% feel like they can be themselves. 88% look forward to going to work. 85% believe their work has special meaning. 85% enjoy psychologically healthy work environments. What's more, rather than one loved ones away, 89% of people at these best workplaces would strongly endorse their organizations to friends and family. The full report, We Need to Fix Work, examines feedback from 2,200 employees surveyed in partnership with Workplace Intelligence across Australia, Canada, France, Germany, India, Mexico, New Zealand, the Netherlands, the UK, and the US, as well as 600 C-suite leaders and 600 HR executives in the US.
You are listening IBG News Golden Hour podcast news read by Billy Joey. Acting Coordinator for Counterterrorism vets travel to Japan, the Philippines, and India. The United States Department states, December 8, 2022. Office of the Spokesperson. Acting Coordinator for Counterterrorism Timothy Betts travels to Japan, the Philippines, and India December 8 to 14th. In Japan, Acting Coordinator Betts participated in trilateral counterterrorism discussions December 8 with senior government officials from Australia and Japan. These discussions focused on the current terrorism landscape, including persistent threats in the Indo-Pacific. In Manila on December 9, he will meet with senior Philippine officials from the Department of Foreign Affairs and Anti-Terrorism Council to discuss ongoing counterterrorism cooperation in the U.S. Philippine Security Partnership. Acting Coordinator Betts concludes his trip in New Delhi, where he will lead the U.S. delegation at the annual U.S. India Counterterrorism Joint Working Group on December 12 to 13. The Joint Working Group will review regional and global terrorist threat assessments, collaborative bilateral and regional counterterrorism programming, and initiatives to strengthen law enforcement and judicial partnerships.
You are listening IBG News Golden, our podcast news read by Mirai. Ministry of Road Transport and Highways in India issued new carpooling and shared mobility regulations. Ministry of Road Transport and Highways has issued the Motor Vehicle Aggregators Guidelines 2020 in accordance with Section 93 of Motor Vehicles Act 1988 for the compliance of all states' UTs on 27 November 2020. These guidelines provide a guiding framework to the state UT governments to consider for issuance of license, as well as regulating the business being conducted by such aggregators. Provision has been made in the guidelines with regards to ride pooling as per Para 11 of the guidelines. Road transport is a state subject and as such, initiatives for planning and management of sustainable urban transport system, including steps to address the problem of traffic congestion on roads, etc., are taken by the respective city-states UTs. A study has been carried out for Delhi NCR funded by Department of Heavy Industries, DHI, Ministry of Heavy Industries and Public Enterprises, Government of India by Tertiary in the year 2018, which reveals that during winter months, transport sector contributes 28% and 24% to PM2.5 and PM10, respectively. Similarly, during summer months, transport sector contributes 17% and 15% to PM2.5 and PM10, respectively. Commission for Air Quality Management (CAQ) in NCR and adjoining areas has framed a policy to curb air pollution in the National Capital Region, which includes strategies for pollution control from various sectors, including transportation. Further, as per Graded Response Action Plan, GRAP, state governments in NCR and GNCTD and concerned agencies are directed to encourage offices to start unified commute for employees to reduce traffic on road, augment CNG electric bus and metro services by procuring additional fleet and increasing the frequency of service, and introduce differential rates to encourage off-peak travel. Further, citizens are requested to use public transport and minimize use of personal vehicles, choose a cleaner commute, share a ride to work or use public transport or walk or cycle, combine errands and reduce trips. Also, government has launched National Clean Air Program (NCAP) to improve air quality across the country. This information was given by the Union Minister of Road Transport and Highways, Shri Nitin Gadkari, in a written reply to the Lok Sabha. Also, in another notice, same ministry laid regulation for controlling use of inferior construction material. All efforts are made to ensure that the national highways, NHs, are constructed as per quality standards specified in the Ministry of Road Transport and Highways Indian Roads Congress, IRC, specifications and codes. Unless the roads are constructed as per the specifications and codes, the contracts are not treated as complete. To ensure the construction quality, consultants, authorities, independent engineer, are appointed by the ministry and its executing agencies for day-to-day supervision of the works at site. Deficiencies, if any, observed during such examination supervision are brought to the notice of the concessionaires contractors for taking up necessary corrective measures. This information was given by the Union Minister of Road Transport and Highways, Shri Nitin Gadkari, in a written reply to the Lok Sabha. Construction of road over bridges. Total 80 projects at a cost of 46,960.52 crore rupees for construction of roads, highways, including that of projects with road over bridges, have been approved on national highways during the financial year 2021 to 2022 and the current year in the UT of Jammu and Kashmir and the state of Maharashtra put together. Funds for development of national highways are not allocated project-wise but are allocated state-wise, UT-wise. For financial year 2021 to 2022 and 2022 to 23 rupees 45,117.02 crore have been allocated by Ministry for Development of National Highways in the UT of Jammu and Kashmir and in the state of Maharashtra put together. Out of 80 projects approved during the past year and the current year, 24 projects amounting to 21,288.98 crore rupees are in progress, which are likely to be completed by August 2025. Remaining 56 projects are in various stages of bidding. This information was given by the Union Minister of Road Transport and Highways, Shri Nitin Gadkari, in a written reply to the Lok Sabha. You are listening IBG News Golden, our podcast news read by Mirai. Department of Atomic Energy by PIB Delhi. Union Minister Dr. Jitendra says 4 units of 1000 megawatts each of Kudankulam nuclear power plant will be completed by 2027. Union Minister of State, Independent Charge, Science and Technology, Minister of State, Independent Charge, Earth Sciences, MOES PMO, Personnel, Public Grievances, Pensions, Atomic Energy and Space, Dr. Jitendra Singh said, at present, Kudankulam Nuclear Power Plant Units 1 and 2 of 1000 megawatts capacity each are already in operation and the remaining 4 units of 1000 megawatts each are under construction. On their progressive completion, the full capacity of Kudankulam site of 6000 megawatts is expected to be reached by the year 2027. In a statement laid on the table of the Rajya Sabha in reply to a question, Dr. Jitendra Singh said, the projected installed capacity of Kudankulam site is 6000 megawatts, comprising of 6 nuclear power reactors of 1000 megawatts capacity each. The first 2 units i.e. KKNPP-1 Andam 2 by 1000 megawatts are in operation and the remaining 4 units i.e. KKNPP-3 and 4 2 by 1000 megawatts and KKNPP-5 and 6 2 by 1000 megawatts are under construction. The power generated by nuclear power plants, including Kudankulam nuclear power plants, is allocated by the Ministry of Power, MOP, to the various beneficiary states, union territories in the region from time to time. The state of Kerala has a firm allocation of 266 megawatts from KKNPP-1 Andam 2 apart from the unallocated quota. Presently, the state of Kerala has a share, firm plus unallocated, of 13.48% from KKNPP-1, 1000 megawatts, Andam 13.30% from KKNPP-2, 1000 megawatts. With regard to the allocation of power from units under construction, i.e. KKNPP-3 Andam 4 2 by 1000 megawatts, Andam KKNPP-5 Andam 6 2 by 1000 megawatts. MOP will take a decision and communicate at an appropriate time.
This is IBG News Golden Hour podcast.